Well, good afternoon. We are so excited you could join us today for our Boston Children's Hospital Winter Wellness. This is an Answers for Family webinar. My name is Kristin and I work in communications here at Boston Children's, but I am also a patient family member and a mom of two teenage daughters. So I'm also very excited to participate in this webinar today and hear from our amazing group of panelists. So we are so lucky to have with us some panelists, wonderful panelists to help guide our discussion. And I would now love for each of them to take a quick minute and introduce themselves. And I will start with Dr. Lee.
Hi, everyone. I'm Dr. Erica Lee. I'm one of the psychologists on the outpatient psychiatry service at Boston Children's.
Thanks so much. Dr. Locke.
Hi, everyone. I'm Dr. Jesse Locke. I'm a pediatrician at Lexington Pediatrics, and we are part of the Boston Children's Pediatric Primary Care Alliance.
Terrific. And Dr. Moffitt.
Hi, everyone. Thanks for having me here today. I'm Kristin Moffitt. I am a physician in infectious diseases here at Boston Children's Hospital.
Thank you so much. Okay, well, let's dive right in because I know we have a lot to cover. So let's start by talking about staying the course with your family's health. And Dr. Moffitt, I would love for you to get us started here. And if you could just talk a little bit about why the flu shot is so important this year and why it is also super important for your child to still be getting their yearly physical and their regular vaccines.
Sure. No, those are great and really important topics to cover. If we start by thinking about the flu vaccine, we should start by just covering some of the basic information about the impact of the flu vaccine. And one would be that we know it varies a bit year to year, but in general, flu vaccination prevents about 30 to 50% of flu infections. So that may not sound like the greatest efficacy, but it is actually really impactful if we consider that there are anywhere from 20 to 40 million cases of influenza infection in the US every year. So being able to reduce that sort of burden on our healthcare system and keep our families and communities as healthy as possible from influenza would be more important than ever. Also, because the symptoms of a COVID-19 infection overlap so substantially with an influenza infection, it would be really important just on a family level to be able to prevent as many of those infections as possible. Many of us may have experienced by now just how disruptive it can be and how frightening it can be if anyone in our household begins to experience symptoms that may be due to COVID-19 or not. It requires everybody staying home and isolating really carefully and finding out how to get people tested. That's a lot for families to go through. And it's possible that if we can prevent influenza infections with flu vaccination, and those infections look a lot like COVID-19 infections, then we can maybe make things a bit easier for families in that way as well. And then I would additionally just mention the other impact of flu vaccination is that even for those who have been vaccinated against the flu, but still get infected with the flu, we know that immunization substantially reduces the severity of that illness. So that's a really important point, because if we think about the unbelievable burden that we are hearing about in terms of COVID-19 surges and ICUs coming close to reaching capacities, being able to prevent any additional burden or as much additional burden on our healthcare system because of influenza-related hospitalizations will be critically important to being able to uphold the ability and the capacity for our healthcare infrastructure to be able to attend to patients with COVID-19 infections as well. And then in terms of the routine childhood vaccinations, that would be another really important point for families to understand is that one of the possible collateral effects of this otherwise devastating COVID-19 pandemic that we're seeing, there are many collateral effects. So these are effects that aren't directly related to COVID-19 infection, but are otherwise indirectly affected and related to the impact of this pandemic on our healthcare delivery in general, would be that children are missing their routine immunizations and they're missing their annual physicals with their pediatricians. It's most recently been estimated that almost 9 million doses of routine vaccines that children otherwise would receive are going to be missed this year because of families understandably wanting to avoid any possible exposures that they worry might be associated with a visit to a doctor's office. But this is going to result in substantial reduction in the community level immunity to vaccine preventable infections such as measles and whooping cough and bacterial meningitis and some severe diarrheal diseases and pneumonia, all benefits that children and adults have received and communities have received from routine vaccinations that we know can prevent so many of these infections. So Dr. Locke can certainly speak to this even better, but it's important for families to understand that pediatricians' offices, primary care offices have been going above and beyond and really to great lengths to be able to continue to deliver routine medical care, including routine immunizations to children and families very safely.
Yep. Thank you, Kristin. I'll just jump in there. Back in February and March and in April, the world panicked, and I think sort of appropriately panicked. We didn't know, what to do or how to deal with the situation, and lots of offices, including my own, was very skeptical about bringing patients in for a short period of time. It lasted about 4 or 5 weeks, but since then we have figured out that we can do a very, very good job of protecting ourselves as providers, and then hopefully by extension our patients from getting infections within our office. Most offices that I know of, including our large office and certainly lots of others in the Boston area, the majority of them have taken really incredibly impressive steps to reduce the chance of any kind of COVID spread within their office. We're a large practice, 40 employees. We haven't had a single staff member who has contracted COVID from a patient, and fortunately, we have had lots and lots of COVID patients coming in through the office. We do testing here, and so there's plenty of full exposure and no transmission of any kind that we're aware of. Now, that having all been said, we're weighing risks here, and like Dr. Moffitt mentioned, the risk of some of the diseases she mentioned, the big ones, like she said, whooping cough and bacterial meningitis and measles, the risk of those infections and the long-term health risks on your children are much, much greater than the risks of COVID. And certainly the combination of contracting COVID when you come into the office and then getting it in such a severe way that it would outweigh getting meningitis. Goodness. So I think essentially every pediatrician that I know of is very enthusiastic to make sure their patients are getting their full set of immunizations at this point.
So important. So please don't skip your visits. Definitely go to your pediatrician's office. So thank you for that. So we're just going to move on. I'd like to, Dr. Lee, if we could talk a little bit about mental and behavioral health for a few minutes here, talking a little bit about why the winter months may be extra hard on kids' emotional well-being, and how can we help children who may be feeling depressed or feeling alone or anxious right now? Like, what are some of the things we can do to help them, and what are also some of the signs that we should be watching for?
Yeah, this is a great question. Thanks for asking it. And I think that the winter months tend to be difficult for everyone anyway. And this year has felt so long. I mean, I think some of us still feel like we're in a never-ending March. That month just seemed to go on forever and ever. And now somehow we're into winter and we're still managing this pandemic, which is really exhausting. And everyone's reserves feel a bit tapped. I think the winter is typically hard because it's cold. The sun seems to set really, really early. And because we're stuck indoors so much, this year it feels even harder to have to be stuck inside because it's cold. And so it's typically a time, I think, when people's moods go down a bit. And everyone's really tired of being cold and stuck inside and all of that. So we're a bit sick of it. I think, the first thing to know is that it's understandable. This is a really hard time for both kids, teenagers, parents, everyone to be feeling a bit down, a bit stressed, a bit less motivated, a bit anxious. All of that, I think, is kind of the typical collateral damage of this ongoing pandemic. So know that that's a pretty normal response. I think most people would say these days that they're feeling a bit depressed or a bit anxious, or maybe a lot of both of those things. The one thing that I always recommend that is the easiest to neglect, but actually maybe also the easiest to restart, is sticking to the basics. So making sure you're just taking care of your physical health, which will have huge positive impact on your mental health. So making sure you're getting enough sleep, that you're following a healthy diet, that you're making regular time for exercise, that you're trying to get some of that social connection and support in wherever you can, that just having those sort of routines and regularity back in your day, back in your child or your teenager's day, can have a huge impact on just sort of how the day goes and how we're feeling physically and then mentally. And then, in terms of some of the signs, the classic signs that we're looking for in terms of being maybe a little bit depressed or anxious, where you might want to talk to someone like Dr. Locke, your primary care provider, and sort of do a check-in about, like, is this something we need to be concerned about? Should we be thinking about working with a behavioral health specialist? Are when some of the things that we're thinking of as quote unquote maybe more normal now don't go away. So this is something like, I'm noticing my child or teenager is having more sad or irritable or kind of like quickly shifting mood, and it doesn't seem to be going away after a few weeks. Or I'm noticing that the things that they normally like to do or things that used to bring them joy, now they're not so much interested in it anymore. They're isolating more. You're noticing any changes in their sleep or appetite, either sleeping a lot more or less than usual. And the same thing on the eating side, eating a lot more or less than usual. Some kids will report that they're really having difficulty concentrating. And some of that, unfortunately, is just the byproduct of remote learning and hybrid learning and having to shift entirely the way that our brains work in regards to school. But some kids, when they're feeling depressed or anxious, really just cannot focus. It's very hard to get them to sort of sit down and do anything for an extended amount of time or for them to complete a task. That can also be a sign of depression or anxiety. Some kids also start to show physical symptoms. So this might be something like, my kid's all of a sudden reporting just a lot more aches and pains. And it doesn't seem like they've got a cold or that they're actually ill, but, there are more headaches, more stomach aches. I'm feeling nauseous. My body just doesn't feel right. I can't go to school today. That can also be a sign of some psychological distress. And then, of course, the biggest warning signs, right, always are if children are talking about, wishing they were dead, wanting to hurt themselves, doing anything to hurt themselves. Those are definitely big flags that you want to be in touch with your healthcare providers to say, hey, my kid's really having a hard time. What can I do about this? And then in addition to just those basics, right, sleep, exercise, diet, socialization, it helps to just sit down with your kids, sort of ask how they're doing, acknowledge that this is a really hard time. And that, again, it's understandable if they're feeling more sad, angry, bored, frustrated, worried. And to share with them sort of, we're having that too, right? Because parents are also really struggling with this. And to sort of validate for your kids, like, we're also struggling with being apart from friends and family, having the holidays disrupted, not being able to go out and do our usual things and see people the way that we used to. And we understand how that feels. Like, how are you doing this week? How are you feeling? And then see if you can problem solve together with your child. Like, can we brainstorm some things to make like a little activity list? What are some things that we can have that you can kind of turn to as like a little activity menu of, if you're having a hard time, what are some things you can do? And I would recommend making that, a combination of some things they can do on their own. It seems like we're having to do a lot on our own these days, but also some things they can do with you at home, with family members in the home, not in the home, with friends, either virtually or even just finding ways to sort of, connect. People are writing letters. People are doing fun things where they're going to each other's homes and like leaving little surprises for each other. So we're still being distanced, but we're staying connected. What are some creative ways that you can come up with as a family within, following public health guidelines and what feels comfortable for your family to stay safe, but still staying connected to other people, so that even though it's different this year, and hopefully with the vaccine, we're turning it around, it doesn't mean it has to be bad. We can still find ways to stay connected and stay healthy.
That's so helpful and so important. And it's a great pivot actually to Dr. Locke. Just a couple of questions for you, just in terms of, what are you recommending for, for families and how they may be able to work with children to stay active during the winter? Because as Dr. Lee mentioned about exercise and trying to keep it some of those basics, what are some recommendations that you're giving to families, indoor and outdoor space? And there's a whole lot of questions here, but also just, what about if they don't have private outdoor space? What are some recommendations you might give?
Absolutely. So just to sort of, follow on for some of the things that Dr. Lee was talking about, I want to emphasize that if it feels to you as a parent like your child is struggling in some way, there's a lot of different options in terms of what the health system can offer. So please don't hesitate to contact your pediatrician, even if it's just a phone call. I think a lot of parents worry that if they bring their 14-year-old child to the pediatrician and they say, I think he or she is depressed, the doctor's going to say, well, we've got about 5 minutes, so let's start your child on a medication for depression, and that'll be the end of it. And I don't think anybody thinks of that as the primary solution. And there's lots more to be done in those situations. And of course, I'm sure, as Dr. Lee has seen, the amount of depression and anxiety has, for me as a primary care doctor, it's approximately tripled in the last couple of months. Although anxiety at the beginning, that's gotten a lot better, but we are seeing more and more depression. And not to be too bleak about this, but the depression we're seeing is in the patients I think who are most vulnerable, which for me is the patients in the group of about age 11 to 16, this very difficult age group where they are starting to have really solid friends groups, but they aren't maybe as sophisticated at maintaining those friends groups over things like text and Facebook and phone calls and things like that. So that's the group I've seen sort of struggling the most. So if we're thinking about how to keep people active and how to sort of follow the basics, as Dr. Lee was talking about, this is going to be a challenging winter. I cannot pretend that there are easy answers here, but it's worth thinking about now when there isn't snow on the ground. I think we've got another 48 hours there. And once there's snow on the ground, it's going to be much, much harder to keep kids active. But there's some things that we can do. So the first thing is, let's just think for a moment, like, why do we exercise? We exercise not to have ourselves like live longer. I mean, yeah, that's a byproduct, but it's really to be happier in the moment. Exercise itself as you're exercising can make you happier, but it really obviously helps a lot with sleep. And there's all these secondary effects that are just proven over and over again to help with depression, anxiety, any type of mental health, really. So that's why we exercise. How much exercise? It can be extremely variable. There was a very funny article that was produced, it was maybe 2 years ago, that said that 1 minute per day of super high intensity, out of breath, sprinting as fast as you possibly can, 1 minute per day is enough to show a physiologic difference, so that you can get into slightly better shape by doing 1 minute a day. I'm not recommending that, but I think a half an hour per day would just be great for kids. That's what I'm trying to do myself. I have a 12-year-old daughter at home, and I promise you I'm pushing her every day to get that half hour in somehow. If you end up doing 3 times a week for an hour and a half, that's outstanding also. No complaints there. But there is something about breaking up the tedium of the day and getting out and doing something active. So then the next obvious question is, what is that thing that is so straightforward for kids to do and to be active? This is where it gets a lot more challenging. I'm sure Dr. Moffitt will have comments about this, but there probably are some sports that are much less risky than other sports if you do have the ability to get out. Tennis seems to be less risky. Swimming seems to be less risky. Running, certainly solo running, is much less risky, especially if done with a mask and outdoors. So there are sports that can be done in a more safe manner. I'll be straight with you. I love playing hockey and I love playing basketball, and I'm not recommending either hockey or basketball because it seems almost impossible to play those sports at a high level without being really in contact with people. And we have had many patients, especially with hockey, see transmission within the family and within the players. So that's sports specifically. Inside the home, there's plenty of ways to get activity. They're not great, but this can be done. I don't love recommending videos to people, but this is a place where, half an hour of an exercise video could be very, very helpful. I actually spent about an hour in the last couple of days looking at children's exercise videos, and they were terrible. But guess what? Kids can do adult exercises way better than most adults can do adult exercises. My personal favorite, if you want the shortest one, is something called the 7-minute New York Times workout. It's outstanding. And if you do it right, by the way, for some reason, it takes 8.5 minutes. Don't ask. But if you do that at full speed, that 7-minute workout, I and everybody I know who's ever done it is very tired at the end, and you get stronger. It doesn't take long. It's a very impressive workout. So that's a video. And there's all sorts of other ones that seem a little bit more appropriate for older kids. Weightlifting videos, that type of thing. But honestly, calisthenics, push-ups, sit-ups, crunches, planks, stuff like that, that is fantastic exercise. And I know that that feels very 1950s, but it is great, great exercise.
It's great that you say that. And some of the comments, you know, some folks are saying, you know, dancing is really popular too with my teen, you know, just dancing around and
so
yeah.
I want to throw in the, there are video games that I play. You feel free to make fun of me. I'm okay with it. But Dance Dance Revolution, I built myself an actual like solid pad. It's awesome. All right. That type of thing is great great exercise, great activities. Obviously there's lots more activities besides sports, but I wanted to start with those if others had other comments.
And so getting outside and really just layering up, right? Just adding those extra layers and getting out there. There's a question, and I would love for you guys to jump in on this, around recommendations for masks while exercising, running and biking, etc. What are some of the guidance you suggest on masks when exercising?
In general, recommend a mask while exercising, but it's especially important if you are going to be exercising around other people. I think if you are going to be out in the woods and jogging on trails or riding a bike or something like that, I think it obviously seems transmission is not going to happen in that way. Have a mask on you, absolutely, so that when you do come within 6 feet of others, even outside, you're able to put that mask on. When it comes to group sports, if your child's still participating in group sports, unless it's something where the mask is going to get soaking wet, like swimming or something like that, your children should really be masked. And again, the mantra is outdoor is better than indoor in terms of transmission risk. We know that the hot spots for transmission are when people who are not in the same household share spaces indoors for prolonged periods of time in particular. So just keeping that in mind, if families make the choice to do some sort of indoor sport this winter when the weather is just too cold to make it feasible to do outdoors, I'm recommending that families just really review with that program what is going to be put into place about mask requirements for everybody who's participating. What is the ventilation like in that building? Are household members and family members going to be restricted at least so that there aren't huge numbers that are in that indoor space for prolonged periods of time together? Those are all really important questions to ask about any program that you're considering having your child participate in this winter.
That's a good segue into a direct question right now, specifically around enrolling in a swim class with other kids indoors. And there's a parent that says they have a 6-year-old who really wants to be in this class, but would love your thoughts on that and just some guidance on this swim class.
Yeah, I think swimming, obviously they're not going to wear a mask when they're in the pool. So I think it gets to the numbers of kids that are going to be in each class, whether there's going to be space in the pool for the kids to be relatively separated. But you could imagine, depending on their swim abilities, they may have floaties on, they may need to have somebody near them, like an instructor, of course, for safety issues. So getting a sense from that program about how swim class is going to look different than it would have a year ago. Are they limiting the size numbers? Are they limiting the time of the class, the duration of the class, so that the time that that kids are spending in the pool together is relatively limited too? And what's the ventilation like in the pool setting as well? And then every family has to make their own decisions and sort of weigh those risks and benefits for their child. But I would certainly at least look into what the program is doing to limit transmission as much as possible in those settings.
Thank you.
Kristin, I would just quick comment about the masks in general. I have found that the actual surgical style masks, which can be had these days online, nowhere near as expensive as it was 8 months ago, they seem to be a little bit better at breathing in when you are doing something at sort of high intensity. And my understanding is they're much better at preventing your breath coming out than say a gaiter or like a thin piece of cloth that comes up, or a handkerchief or something like that.
Right.
Yeah, no, the surgical masks are much more available than they were 9 months ago, certainly. I think when there was just a shortage in the supply chain, and there was a lot of concern about whether or not surgical masks would be available for healthcare workers. But the supply chain seems very steady right now, and they're not nearly as exorbitantly priced as they used to be. Cloth masks still can be very beneficial. There are some recommendations on the CDC website about what kind of cloth mask is maybe better than others. The recommendation is at least a 2-ply, typically cotton because it's more breathable and easy to breathe through, but at least 2-ply, if not 3. But again, depending on how easy it is for your child to wear and how breathable it still is for them if they're wearing it while they're participating in any rigorous activities.
Great. It's super helpful. Thank you. And just shifting as we're still talking about winter activities, part of that includes social gatherings, including the holidays. It's almost hard to believe, but we're there among us right now. This is for all. What is what is recommended and what is not recommended on how to celebrate with families, and how can we be staying vigilant with COVID prevention measures, even if we're experiencing social distancing and mask fatigue? And do you have any recommendations on like different fun ways to celebrate or socialize with, virtually with family, with friends? But this comes up a lot, right? Around like, what do you recommend now that the holidays are here? How should we celebrate or how should we not celebrate?
I'm happy to start with this sort of the heavy-handed part of that.
You're the bad cop, Dr. Moffitt.
I think it's very similar to conversations we were having the weeks coming into Thanksgiving. And I think it's no coincidence that we are seeing surges of hospitalizations and ICUs reaching capacity now at our sort of 3-week post-Thanksgiving time point. That is exactly the time frame at which you would have expected that exposures that people experienced by gathering during Thanksgiving could have typically 4 to 7 days later led to infection that would typically start to worsen to the point where someone might need hospitalization or ICU level care about a week after onset of symptoms. So that is exactly where we are right now. So I think it's just really important for families to keep in mind that holidays that are upcoming really should look a lot different, frankly, than they have in years past. Knowing that the reason to have restraint this holiday season around seeing your loved ones and gathering indoors with people outside of your household is so that all of those people can stay healthy and be reunited and get our holidays back to normal again once we are through this pandemic. So I would just really ask people to keep that in mind. I know people want to be with family so badly. We're more strained and feeling more isolated than we ever have, but now is not the time to let up on everything that we have been doing to keep ourselves and our families safe for the last several months.
And Dr. Lee, could you maybe share, maybe some ideas around what are some of the different and fun ways that we may look to celebrate or socialize virtually with families? If there's any guidance you have on what we can potentially do to keep folks, engaged and happy.
Yeah, I mean, I want to say first that I obviously 100% agree with everything Dr. Moffitt is saying. It's so painful. And I think as we've headed toward the end of the year, just as we talk about Zoom fatigue, there's also pandemic fatigue. But being tired of the pandemic doesn't decrease the risk. And so even though I think people are really looking for that bright spot at the end of the year, that ongoing vigilance and really following those public health safety guidelines is still so critical to turning this around. And I think, just acknowledging again first that this is really hard. I mean, the holidays are typically a time of the year that everyone looks forward to all year. It's meant to be celebratory and joyous, and it is typically a time when people gather in pretty large groups, with loved ones. And so having that sort of taken away, especially for children and teens, can feel especially painful this year. So what I'm encouraging families to do is to think about, okay, we can't, just like Dr. Moffitt was saying, we can't celebrate the same way, but that doesn't mean we can't celebrate. It doesn't mean it can't still be meaningful and special. And so really, I'm encouraging families to think about, when you think about, whatever holiday celebrations you typically participate in, what's the most meaningful part or parts of that? So maybe we can't all gather for, a big meal that's at a certain person's home like it is every year, but maybe the highlight of that meal is that there's one particular dish that's been this family tradition that everyone really looks forward to, or maybe each family that usually comes to that gathering has their own favorite dish. And so maybe we think of a time of, okay, it's not the same, but we're going to virtually celebrate so we can at least still have this shared experience where we're doing the same thing at the same time, and where each family is going to make either the same dish that everyone really loves, or we're each going to make our family's own dish. Or is there a way to just sort of, again, link households to each other? So we're going to pick a time where each household is going to sort of like, if you do presents or some sort of gift exchange, if there's singing, if there's dancing, whatever those holiday traditions are that feel the most special to you, can we schedule a time where we're all going to do that together via Zoom? Because the goal really is to have that shared experience, even if you're not physically in person. So there's lots of ways, I think, to be creative about how we can still stay connected to each other, but safely, meaning that we're all in our own individual homes, but we're still doing something that feels meaningful to all of us. And I'll also suggest that you all check out the Discoveries blog that Children's does such a nice job of keeping up, because we actually did a blog post before Thanksgiving, already thinking about this, that's got some more suggestions for ways to be creative about celebrating the holidays and keeping that sort of holiday joy alive, even though it'll be different this year.
Yeah, it'll definitely be different. Dr. Locke, did you have anything you wanted
to? So Dr. Lee had talked about, sharing a dish together. I think a lot of people, when they think about holidays, they think of the food that comes along with it. I certainly do. Thanksgiving and Christmas especially, but, really any holiday, 4th of July, whatever it may be. And one thing that kids can do that we do not make them do often enough is cook. I think that, I'm not sure, what the residual is here, why this hasn't sort of developed, but it has seemed to develop more over the course of the last 6 months. Families, especially young teenagers and, 8, 9, 10-year-olds are really participating much more in the sort of, hopefully that the household process in general, not just the fun part like cooking, but, laundry, et cetera. But for holidays, for our Thanksgiving this year, we did a Zoom call with the extended family, which it was exactly what you expect it to be. It was, we got to share some stories and talk, and it was nice, but it was not the same. And we all felt, it was a little disappointing. It was hard. But what was great about Thanksgiving this year was instead of 1 or 2 people cooking and the rest of the people outdoors, throwing a football around or, whatever, people do sitting around in the living room, everybody cooked together. Really, that's in my household, that's 3 people. But we got the 3 of us together. And again, instead of just one person cooking, the 3 of us cooked together. My 12-year-old daughter is a great cook, but your 3-year-old child does not have to be a great cook to be able to help with portions of cooking. And I think it's a great way also to engage teenagers. If you can get a teenager cooking with you, something that's going to take time, it's a reasonable way to engage them in conversations that you might not be able to in other environments.
For sure. 2
birds, 1 stone there.
Yes, and it keeps them off of their screens for a little while, which is another topic that we'll get to in just a little bit. So as you know, we've been collecting a number of questions leading up to this webinar, and there were a ton of them and wonderful questions. And so I'd like to just dive right in and get started on with some of these submitted questions. So the first question is something that I know we did touch on a little bit around the anxiety that some patients are feeling. And there were a number of live questions that actually came in that said, I have a child that's, extremely, resilient and has always been resilient, but lately now there's this isolation and sadness that's setting in. What can we do to keep kids with, already, that are resilient, or kids that aren't, maybe kids that already have existing anxiety, from becoming a little too comfortable with isolation, and because I know that is a fear of, this is getting a little comfortable. They're, on a screen, or they're doing remote school. And then in the evening, the only way they, somehow communicate is, alone in their room on their screen. So what can we do to work towards getting them less comfortable with isolation?
It's a great question. It's almost this thing where we're all so sick of isolation, but we're also getting used to it and don't know how to be around other people anymore. Yeah. The pandemic has just turned everything upside down. I'm really pushing families for balance, right? Is that everyone needs alone time, including parents, right? You also need some space for your own self-care, especially if we're all at home and we're all just together all the time. It almost feels like we're all just too close to each other. We're not used to having that space anymore, even for parents just to, have their usual commute is not necessarily something that they're experiencing on a regular basis anymore. But I'm really encouraging families to, talk to their children and teens about how do we create balance. Of course, there's going to be some time where you're on your own or you just want to be on your phone, especially for those preteens and teens and even young adults. But also, like, let's make sure we're getting regular family time, which actually ironically can sort of be an easy thing to miss because it feels like we're together all the time. We might physically be sort of, in the same spaces, but that doesn't mean we're necessarily spending time sort of connecting and getting that quality time together. And for kids who are just sort of isolating more, maybe spending less time even interacting with others beyond sort of remote schooling, is how do we make sure, especially for those kids who maybe are a little bit anxious anyway about social interaction, that they're pushing themselves a little bit. Because of course the goal is that this new normal that we've all settled into is not our new normal forever, right? Our hope is that we're starting to sort of turn the corner as we move towards mass vaccination. And so this idea of talking with your child or your teen about how can we always be pushing yourself a little bit, that even if social interaction is anxiety provoking for you, and maybe even more so now during the pandemic where you've just naturally had to do less of it, what are some small ways you can challenge yourself, whether that's every day or every other day? You're going to make sure you're texting a friend, or we're going to set up regular like FaceTime or Zoom dates, or maybe a lot of people are doing those sort of like virtual or like drive-by like birthday or holiday celebrations, that we're going to participate in those, or we're going to make sure that you're at least getting outside, so even if you're not talking to people, you're distantly around people. What are some ways to continually be sort of challenging yourself so that when we return to regular in-person schooling and activities and all of that, it doesn't feel like such an abrupt and shocking shift. So how do we just keep challenging ourselves to have some balance, some time with other people, some time with friends, some time with family, and then also an appropriate amount of time for yourself?
Yeah, for sure. Dr. Locke or Dr. Moffitt, did you want to jump in on any of that?
Just if one of the most helpful things that I have seen with kids, obviously the people who are most isolated are the patients over the age of 8, 10, 11, in that general range. And one of the most helpful things I've seen is parents creating an expectation of something every single day. If you walk into a 14-year-old's room and they're on their phone, you say, hey, how about you come downstairs? Let's go play cards together. Let's play a board game. They're going to look you in the eye and say no, or something less polite than that. But if there's an expectation, hey, in order to get the Wi-Fi password, all you got to do is spend 30 minutes a day doing X, Y, Z, 30 minutes a day with the family, or cooking with the family, or taking the dog for a walk. But it's the, creating the expectation every single day. That's a lot of the burden is then on us as parents, but that's sort of what we have to take on if we're going to get the teenagers out.
Yeah, I know. I deal with that myself. And a couple other questions around the socialization and the Zoom burnout that's happening with remote schooling. Should we look at like setting some time during the day where there are no screens? How can we get to that point where, because I'm finding it with my own as well, they're on screens constantly, and it's the only way they can socialize with friends, right? So, is there something that we can do? I know it's like, if you have the perfect answer for teenagers, let shout it far and wide, but what are some suggestions on, and to go a little bit further, Dr. Locke, on, working with your kids to get them away from the screens a little bit? There's a number of questions that have come up around screens.
Of course. I'm sure Dr. Lee will have lots to say about this as well, but so there is a bit of a hierarchy in terms of screens, in terms of good versus bad. The worst screen time, but perhaps most entertaining and relaxing, is just sort of binge watching YouTube videos, Netflix, Amazon Prime, whatever it may be, just sort of passively watching. Sort of above that, I would actually put socialization time. So parents are sometimes saying, well, it's all that they get for socialization time. Yes, totally true. And if your child spends 2 hours a day socializing with their friends on Facebook or playing a video game at the same time that their friends are playing, we can all see the benefit there. Next level on the hierarchy is something creative. So sometimes teenagers will do things like computer programming, or working with Pixlr, or Photoshop type things. There are things you can do on the computer that really are active and basically fall under the category of hobbies, and that's definitely better. So I think if parents are going to sort of push back hard, you need to sort of focus your attention more on the pure entertainment, passive type of screens, wherever you possibly can.
Yeah, and I would just, those are great ideas, Dr. Locke. And I would just add to it again, balance, right? So, Kristin, I think the way you're asking the question, I think that makes a lot of sense. I actually am encouraging parents to have some time that is mandated to be off screens, because if we're thinking about things like even exercising, so that might involve screens, right? But I think that falls probably on the better end of Dr. Locke's hierarchy, right? Of like, am I getting myself moving? So for example, even for our young kids, a lot of the younger kids that I work with are really enjoying like the Go Noodle YouTube channel that has like really fun and silly like exercise videos where the kids kind of dance and they learn like different fun like exercises that they can do. That's watching a screen, but it's also interactive. It's boosting their mood and it's actually getting them exercise. Or even if it's something like, some kids have actually, some of the teenagers and tweens that I work with have started doing this thing where they'll technically be on FaceTime, but they're actually all doing homework together. So it's the sort of thing where it's like, I'm still socializing with my friends. Maybe we're talking, maybe we're not, but it's literally, their replication and right now COVID approximation of being at someone's house where we're all just doing homework and like having a snack. So they're interacting with each other and it is technically screen time, but it's also not, right? So that how do we sort of find ways where there is socialization that maybe is through the screen, but also maybe the two birds, one stone, like Dr. Locke was saying before, where you can kind of get something else in. And then the balance, how do we actually have times where we're doing something that doesn't involve screens at all? So we're not just endlessly scrolling on social media. We're not just sort of mindlessly watching something on YouTube or Netflix. We're not necessarily interacting with our friends. We're doing something at home, whether that's an individual hobby, whether that's homework, whether that's just interacting live with the people we live with and that we have physical safe access to, so that we do sort of just take breaks from screens, because it's so easy to get sucked into, oh my gosh, school ended, it's 7 hours later, it's time for bed, and I never got off of one form of a screen or another.
And it's so hard too for some parents. There's a couple of comments about parents even feeling guilty about the amount of time that their kids are spending on screens and that they feel like they're not doing a good enough job. But I think the way you've sort of outlined it, which is actually there's positive screen time that's actually helping to contribute to a positive experience and helping with socialization and connection versus the less, important, screen time. And then how do you balance that?
100%. And I think one thing that's really come out of this pandemic is, parent guilt of just being really hard on yourselves. I mean, I think parents are hard on themselves all the time, but we are in a pandemic. Everyone is just doing the best they can to get to 2021. And that includes parents. If your children are alive and they're healthy and you're doing the best that you can to communicate with them, to listen to how they're feeling, to keep them physically safe and healthy, you're doing everything you need to be doing. That doesn't mean we're going to hit the mark and do all the things we ideally would want to do if we weren't in a pandemic. Absolutely. And I think screen time, honestly, is one of the places where, again, I think striving for balance rather than sort of maybe that conception you had before of like, what was an appropriate amount of screen time, and giving yourself as a parent a little bit of that grace and flexibility, I think is really good, because you need to notice for yourself too, that this is also hard for you. And if you're doing the best that you can and you're showing your child that you love them and you're there for them and you're all making it through this, that's really all you should be asking of yourself right now. It's really hard. And I think especially the screen time piece, a lot of parents have had to let themselves go in terms of their limits on that, because it's one of the only ways their kids can socialize. It's how they're getting school. So, be kind to yourselves.
Be kind to yourselves, for sure. And it's a great segue into talking a little bit more about, you said we are in a pandemic and we're trying to keep everyone safe. And so Dr. Moffitt, can we talk a little bit about, we've gotten some questions around, from patient families around their immunocompromised child. Mm-hmm. And so what are some of your suggestions on how they could stress to family and friends the importance of being diligent with their immunocompromised child?
Yeah, no, that's a great question. And it's certainly something that I have heard from a number of families that they're struggling with. That they have grandparents, cousins that really miss the family and they want to be together. And it's really hard to make that impression on them that, you as a parent are really doing the best you can to keep your child safe, and that families really need to respect that. I think part of that messaging can come from just making sure that families and friends who may be putting some pressure on others to get together or otherwise take exposures that they aren't willing to risk, that there is still a lot that we don't know about COVID-19. We know so much more now than we did 9 months ago. It's remarkable, actually, how much more we know. But there still is a fair amount that we don't know. And no one has ever seen a global effort among communities in healthcare and in science to understand this as much and as fast as possible. But absolutely, it's understandable that a parent would want to keep a child with an immunocompromising condition or any other household member with either an immunocompromising or a high-risk condition that potentially puts them at risk for more severe COVID-19 infection as safe as they possibly can. And part of the messaging around why that's so important right now would be that we are seeing rises in community transmission essentially everywhere right now. And that there is truly no activity that families can undertake with people outside of their household that is a zero risk activity. There are things we can do to moderate that risk and to reduce it as much as possible. But with community transmission surging the way it is essentially everywhere in our country right now, there's no way to make it zero risk. So I think sticking your ground with others around you who are sort of pressing you, potentially pressing you as to being able to maybe take risks that you wouldn't otherwise be comfortable with. It's completely reasonable to stand your ground based on what's happening with transmission right now. And with the understanding that we will get through this, and there will be a time when we can lighten up on all of these practices and everything that we're going through. It's just not the time right now.
For sure. A question around keeping babies safe during the pandemic that aren't wearing masks, that are under the age of 2. Any, suggestions, both Dr. Locke or Moffitt, around what are some of the things that families can do about keeping them safe?
Yeah, if you think about what babies are exposed to most, babies are exposed to their family and their household. So it really gets to keeping others in the household as safe as possible. So anyone who is old enough to get a flu vaccine, stay up to date on their other vaccines, wear a mask when they leave the house, wash their hands when they have come into contact with surfaces outside of the house, wash their hands as soon as they come back into the house. Really extending that sort of branch of safety to everybody in the household is what families can do to best keep babies safe, babies who aren't able to wear masks or who are maybe too young to get a flu vaccine themselves.
Babies who are small, under the age of 9 months, we think of ourselves as very, very social creatures, but those babies will do fine if they don't see grandma up close. Now that's a terrible, terrible thing, and I'm going to get very angry emails probably from my daughter's own Nana. But under 9 months, the socialization is much less important, and their immune systems are not quite as strong. So the benefit of getting the families together is really more for the grandparents and the parents than it is for the kids at that age. I certainly don't want us to go a full year or 2 years without our kids seeing their grandparents. That's not acceptable. It's a tragedy beyond words. But they'll do fine. The little kids will do fine on their own.
Oh, that's helpful. Some questions around, since the holidays, is preparing, foods and sharing food. So some questions around, what do you think about giving uncooked food to share? Maybe like a homemade pie or a ready to bake family to cook, maybe just like to cook at their own house. So maybe like preparing it partially and then just having them bake it, or sharing, jars of soup, like simmering it at home. So what are your thoughts about giving uncooked food out to share with family members?
I'm certain that no matter what we say here, that is going to happen lots and lots and lots. People can't resist doing that.
Yeah.
But I'd be very curious to hear what Dr. Moffitt had to say about that.
Yeah, it's one of the ways that we can show others that we care when we can't physically be with them. I think it's a very, very, very low risk that transmission of COVID-19 would happen through food that someone has shared with someone outside of their household. One of those things I was referring to that we've learned so much about in terms of SARS-CoV-2 and COVID-19 transmission is that while it still is theoretically possible that if a surface, for example, had a very high burden of the virus that causes COVID-19 on it, and somebody came by and immediately touched that surface and went and touched their own mouth or nose or eyes, you could conceivably infect yourself that way. But it's a really, really unlikely scenario. We've learned a lot about just how easy it is to kill this virus on surfaces. It's not a very hardy virus, actually. It's killed by almost all cleaning products, but it also just frankly doesn't survive on dry surfaces very much. So there are often a lot of questions about groceries and should I be wiping my groceries down? My advice to people around groceries is you don't need to wipe down everything that came home in your grocery bag. If you are about to eat a piece of fruit or a vegetable raw that you're going to eat the skin of, you should wash that with soap and water and wash that with water and wash your own hands with soap and water before you eat it. But I would have recommended that to you outside of a COVID-19 pandemic. Mm-hmm. So I think that based on what we know now about how insignificant the contribution of transmission from contaminated surfaces is likely to be, I think we can start to all use some common sense with sharing food. If you want to prepare something and leave it on a loved one's or a friend's doorstep for them to heat up in their own oven, I think that the heating process alone, if there were any virus that were part of the preparation process, the heating process alone would kill that virus. Even if you're frankly going to leave something that you've baked that is not going to be reheated or recooked, as long as you are safe when you're preparing it, don't prepare it if you're symptomatic at all, of course. But as long as you are safe when you're preparing it, you've washed your hands with soap and water and taken appropriate precautions to prepare that food. And I think it would be safe to share with others.
That's really helpful. Another question that's come up quite a bit is we were talking about outdoor time. How safe do you feel like playgrounds are, assuming everyone is using masks?
I feel that outdoor spaces in general are good places for people to be, assuming that they're wearing masks and can still maintain some distance. Mm-hmm. So if the concern is for contamination potentially of structures on the playground, again, I think that risk is very low, particularly if the people who are on the playground are also all wearing masks. It's a great chance to remember that bring some hand sanitizer with you. If your kids are of the age that they just can't resist touching their face and they've been on a play structure, it would be a good idea to go and have them use some hand sanitizer relatively frequently during that outing. But a chance to get outdoors and get some exercise, I think it can be done relatively safely.
That's really helpful. And we just have a few quick minutes. So I just wanted to maybe quickly just go around and just maybe a couple of last, maybe something we didn't cover that you feel like you just want to really emphasize. I know that this is going to be a tough few months. It's the winter, it gets dark and it's colder out. So Dr. Lee, just a couple of, words of closure from you would be great.
This has been such a hard year, as we've been talking about, for kids, for teenagers, for parents, for everybody, for the whole world. I think my takeaway that I hope that parents would remember is that kids are really resilient. So obviously, as we've been talking about, this is unprecedented. That's like the word of the year, right? No one has ever, thankfully in their lifetimes, had to do something like this before. But kids are really strong and resilient, and they will bounce back from this. So even though obviously there might be some short, and then for some kids, longer term kind of fallout from this, most kids actually will turn out just fine. And I think for parents, the main thing to remember, not only is that your kids are resilient and can make it through this, but that they take their cues from you. So it's really important that you also take care of yourselves, because if you don't have your oxygen mask on, there's not a lot left to continue to give to your kids, and you're always doing so much for your kids. So be sure to also prioritize yourselves through this, because your kids are looking to you for role models of how to cope during this hard time.
So true. Dr. Locke?
Yeah, it's something I say to my patients, the parents of young kids. We have to do a procedure, something's going to be challenging, or procedure, it's going to be painful. I say, your child is not going to remember this, you're going to remember it forever. That's how it works, certainly with young kids. If I could pitch one last thing, it would be the idea of hobbies. Again, I feel like I'm talking out of the 1950s when I talk about stuff like this, but there seems to have been something that is lost in the last 10, 15 years of screens have been on the rise. And yes, I'm one of those people who laments the rise of screens, but there are so many great hobbies out there. I'm not talking about like coin collecting and things like that, although I'm sure that's a wonderful hobby as well. But there are lots and lots of things that kids can take on that can keep them active and engaged, that are not terribly expensive. Lots of them essentially free, that are things that can sort of help get us through the winter this winter. So you don't need me to give you the list of hobbies that a kid can take on, and of course it's going to be very, very kid specific. But that is my biggest pitch. If you're looking for something for this winter to do, help your child find a hobby.
Dr. Moffitt?
Yeah, I'm so appreciative of what Dr. Lee has said about parents really, really finding the time to take care of themselves as well. The next couple of months are going to really call on our resilience more than perhaps anything any of us have ever experienced before. So we as parents, we are doing so much to keep ourselves afloat, whether it's by still meeting our work obligations, meeting our obligations to our families and to our kids, and just keeping it all together, that really giving ourselves a little bit of leeway here, to not expect that you're doing anything perfectly. Nothing can be done perfectly right now. But if you are able to take care of yourself and give yourself some time to do whatever it is that you need to do to feel as solid as possible right now, modeling that for your children will go so far as well. And I think it will also go so far to us being able to continue to stay vigilant for the next few months, which is just going to be so important to the trajectory of this pandemic.
Absolutely. Vigilance, resilience, and layers. Wear layers and get outside. But that's all we have for today. But we have a ton of questions. I just want to let you know that please follow us on Facebook or Instagram if you aren't already following us on Facebook or Instagram, because we will be addressing a lot of your unanswered questions there throughout the next couple of months. And for more resources about COVID-19 and kids and health, please visit bostonchildrens.org/COVID. And we want to wish you well, be safe, and wishing you and your families a healthy holiday season. Thank you all. Take care.